Colfax, Director of Health here at the San Francisco Department of Health. Today, the San Francisco Office of the Chief Medical Examiner released monthly data indicating that 61 people died of an accidental overdose in San Francisco in the month of March. This is 7 under the March 2023 count, when unfortunately 68 lives were lost. As has been the trend, most of these deaths are caused by fentanyl. Fentanyl is much more deadly and insidious than any other street drug that we have faced before. We are in an unprecedented place that has challenged us to constantly evolve, pivot, and refine our approach to the overdose crisis. But there is hope. Recovery is possible for everyone, especially with accessible medications for substance use disorder. These medications, buprenorphine and methadone, cut the risk of death by 50%. Last year, here in San Francisco, 2,200 people received methadone, but we need to do more. We need to increase access to methadone. That is why we were so pleased when federal regulations were recently changed to make methadone more accessible to the people who need it most. Prior to these changes, methadone could only be dispensed through licensed opioid treatment programs, tightly regulated by federal and state governments. I would say over-regulated. But now, under these updated regulations, there's more flexibility. For instance, physicians outside of an opioid treatment program can now provide a 72-hour supply of methadone to a patient for relieving acute withdrawal symptoms while making arrangements to refer for treatment. Unfortunately, current California law does not align with these updated federal regulations, which means Californians can't immediately benefit from this new flexibility to accessing life-saving medications. However, thanks to Assembly Member Haney, there's currently a bill, AB 2115, that will align state and federal regulations and lower the barriers to people who want medication. Simply put, this bill will make methadone more accessible to the people who need it most and save lives. AB 2115 will allow people to access 72 hours of methadone at more clinics. Still, in California today, people can only access methadone at specific designated clinics, which are limited in number, hours, and weekend availability. This bill will increase access to treatment, and thanks to federal leadership, allow us to provide methadone in more flexible ways to meet the needs of our patients. We have been held back too long by outdated, over-bureaucratic regulations. We thank Assemblymember Haney for leading this charge and this change. The Department of Public Health, multiple San Francisco Board of Supervisors and other county health departments, along with the California Medical Association and the California Society of Addiction Medicine, are in support of this bill. Now I would like to introduce Dr. Joanna Eveland, one of our chief medical officers, who is a key leader and boarded in addiction medicine, who is driving change to make life-saving treatment more available to people with opioid use disorders. Dr. Eveland, thank you.
Thank you, Dr. Colfax. With more than 199 preliminary accidental overdose deaths so far this year, we continue to evolve and adapt our substance use services to mitigate this overdose crisis. We're working to make treatment more easily accessible and to get as many people as possible on the road to recovery. And we're focusing our efforts on strategies that make the highest impact. Our recent efforts focus on making treatment available at night in the Tenderloin. In October, DPH launched the Night Navigation Program, staffed by Code Tenderloin, to connect people at night to services. The Night Navigator program has been very successful in finding people shelter. Just in March, the team transported 176 people to shelter. The Night Navigators also identified the need to connect people to treatment while linking them to shelter. And as a result of that feedback, we launched a pilot program to prescribe and support initiation of buprenorphine for people who want treatment after being placed in shelter by the Night Navigators. After a person outreached by the Night Navigators is interested in treatment, our team transports them to a safe space for the night. We connect the individual to a doctor either in person or via a telehealth appointment assess their substance use, and can prescribe immediately a medication for substance use disorder, such as buprenorphine. The medication is then delivered directly to the individual, or they can receive support to pick up the prescription if they prefer. A case manager meets with that person daily over the next week to create a long-term care plan that might include either residential treatment or outpatient treatment in shelter, depending on the person's needs. And one might ask, what if they wake up and change their mind? That's a risk we're happy to take if there's a chance to get a person on the road to recovery. Anytime someone wants to enter treatment, whether that's day or night, we want to answer that call for help whenever possible. During the daytime, we have a lot of treatment options. At night, there are fewer services, and this pilot fills a gap. In the first 3 weeks of March, we did 106 telehealth visits, with 94% of those patients making a plan to start medication. And again, we know these medications for opioid use disorder are highly effective, life-saving, reduce the risk of death by 50%. A key component of this pilot success has been having that safe space where people can start their medicine and receive some ongoing support and care coordination after that initial engagement by the navigator. So we want to thank the Department of Homelessness and Supportive Housing, 5 Keys, the San Francisco Community Health Center, and Health Rights 360 for their partnership in this effort. And now I'm honored to welcome to the podium Donna Hilliard of DPH Night Navigation Program and Code Tenderloin. Our collaboration with Code Tenderloin has been very successful, and it's been such a privilege to work with Donna and her team.
Thank you so much. So my name is Donna Hilliard, and that's spelled H-I-L-L-I-A-R-D. I'm the Executive Director of Code Tenderloin. And me and myself and the team, we are all compressed of folks with lived experience. And so we're taking that lived experience, we're able to take it to the street and talk to people about drug addiction, talk to folks about options, but most importantly, build trust with the community. Letting them know that we were once where they were at and that they too can get off the street. And so we are living proof that recovery works and there is a way out of this. Since October, our night navigation team has been in the Tenderloin and Soma neighborhoods from 7 p.m. to 3 a.m. talking to people about, treatment options and connecting them to city resources. We do see this is working. A lot of times we talk about numbers, but I have to tell you, just earlier today, a man stopped me and he said, "Hey, I want to thank you. I got into drug rehab, and for the first time in a long time, I can actually see a light at the end of the tunnel." To me, that is all the proof I need that we have to continue to do this and to come up with efforts that support this. So we transported about a dozen people a night to emergency rooms, to overnight mental health clinics, respites, shelters, Soma Rise, and the Drug Sobering Center. Early in the program, we knew that there were people who were not accepting help during the day, but were more acceptable to this help at night. We were able to take that feedback and give it to DPH, and I just want to applaud DPH for actually hearing us, for actually taking our words and saying, hey, this is what we're seeing on the street, and let's come together and figure out a solution where we can expand on this. And so we were able to offer low barrier access to medication and opiate addiction at night. This is something that's new. It's something that should be worldwide because it's working and it's changing people's lives. So in March, our program expanded from 5 to 7 nights a week to support the pilot as many people and to get as many people into treatment as possible. People are suffering out there. We all know this. No one can do this alone. And by all of us coming together, we're actually being able to help people get the tools they need to get to the next steps to recovery. To all the parents and family members who are out there who have someone that's suffering on the street, I want you to rest assured we're going to do everything we can to get them the help that they need, but not only the help they need, but the help they deserve. And so finally, I would like to thank Dr. Colfax wholeheartedly, because his leadership around this issue speaks volumes. He's gone out with us several times at night to talk about how can we make this program better and how can we bring the folks with the lived experience together with the folks at DPH and make this really work. So his authenticity speaks volumes, and proud to stand here today with DPH to talk about this. Thank you.